Boxer dogs and bloat, gastric dilatation-volvulus recognizing and responding to a life-threatening condition. Boxer dogs and bloat, gastric dilatation-volvulus recognizing and responding to a life-threatening condition. This video discusses the condition of bloat in boxer dogs, also known as gastric dilatation-volvulus, GDV. Bloat is a serious and potentially life-threatening condition that can affect boxer dogs. It occurs when the stomach fills with gas, causing it to twist and trap the gas inside. This can lead to a variety of symptoms and complications if not recognized and treated promptly. Recognizing the symptoms of bloat is crucial for early intervention and a better prognosis. Common signs of bloat in boxer dogs include restlessness, excessive drooling, and a distended abdomen. Other symptoms may include unproductive attempts to vomit, rapid breathing, and pale gums. It is important to note that these symptoms can vary from dog to dog, so it is essential to be vigilant and seek veterinary help if you suspect your boxer may have bloat. In order to respond effectively to this life-threatening condition, it is important to act quickly. Time is of the essence when it comes to bloat, as the longer the stomach remains twisted, the greater the risk of complications. If you suspect your boxer may have bloat, it is crucial to seek immediate veterinary help. A veterinarian will be able to diagnose the condition through physical examination and diagnostic tests such as X-rays. Treatment options for bloat may include decompression techniques to release the trapped gas and relieve the twist, as well as surgery to correct the stomach position and prevent further complications. Understanding the symptoms of bloat and knowing how to respond can make a significant difference in the outcome for your boxer dog. By being aware of the signs, seeking prompt veterinary help, and following the recommended treatment options, you can help ensure the best possible outcome for your beloved pet. Symptoms of bloat. When it comes to recognizing bloat in boxer dogs, being aware of the common symptoms is key. This life-threatening condition, also known as gastric dilatation-volvulus, GDV, can rapidly progress and requires immediate attention. By understanding the signs, you can take prompt action and improve the prognosis for your beloved pet. One of the first symptoms you may notice is restlessness in your boxer dog. They may appear agitated, unable to settle, and constantly shifting positions. This restlessness is often accompanied by excessive drooling, where you may notice a significant increase in saliva production. Keep an eye out for your dog excessively licking their lips or leaving wet patches wherever they go. Another telltale sign of bloat is a distended abdomen. Your boxer's stomach may appear swollen or bloated, giving them a rounded or tight appearance. This is caused by the accumulation of gas or fluid in the stomach, which can lead to a dangerous twist known as volvulus. Early recognition of these symptoms is crucial for prompt treatment. If you suspect your boxer dog may be experiencing bloat, it is important to seek veterinary help immediately. Time is of the essence when it comes to this life-threatening condition, and early intervention can greatly improve the chances of a successful outcome. Risk factors for bloat. Risk factors for bloat. When it comes to bloat in boxer dogs, certain factors can increase their risk of developing this condition. By understanding these risk factors, you can take preventive measures to reduce the chances of your beloved pet experiencing this life-threatening condition. Genetics. Genetics play a significant role in a boxer dog's susceptibility to bloat. If your dog has a close relative who has experienced bloat, they may be more prone to developing it as well. It's important to be aware of your dog's family history and discuss it with your veterinarian. Eating habits. The way your boxer dog eats can also contribute to the risk of bloat. Dogs who consume their meals too quickly or gulp down large amounts of food in one sitting are more likely to experience gastric dilatation-volvulus. To prevent this, consider using slow feed bowls or puzzle toys that encourage slower eating. Exercise routines. Strenuous exercise immediately before or after meals can increase the likelihood of bloat in boxer dogs. It is essential to allow your dog to rest for at least an hour before and after meals to aid in proper digestion. Avoid intense physical activity during these periods to minimize the risk. Other factors. While genetics, eating habits, and exercise routines are significant risk factors for bloat, other factors may also contribute. These include stress, anxiety, and certain medical conditions. It's crucial to monitor your dog's overall health and well-being and seek veterinary advice if you notice any concerning symptoms. By being aware of these risk factors, you can take proactive steps to reduce the occurrence of bloat in your boxer dog. Remember to consult with your veterinarian for personalized advice and guidance based on your dog's specific needs and circumstances. Preventive measures. Preventive measures play a crucial role in reducing the risk of bloat in boxer dogs. By implementing these measures, pet owners can help safeguard the health and well-being of their beloved furry companions. Here are some preventive measures that can be taken. Feeding smaller, more frequent meals. Instead of feeding large meals all at once, it is recommended to divide the daily food intake into smaller portions and feed them throughout the day. This can help prevent the stomach from becoming overly distended, reducing the risk of bloat. Avoiding strenuous exercise after meals. Engaging in vigorous physical activity immediately after meals can increase the likelihood of bloat. It is advisable to allow a sufficient amount of time for digestion before engaging in any strenuous exercise or play. Using elevated food bowls. Elevated food bowls can help promote better posture during mealtime, reducing the chances of swallowing excessive air while eating. This can be particularly beneficial for boxer dogs, as it can help prevent the occurrence of bloat. These preventive measures should be incorporated into the daily routine of boxer dog owners. By being proactive and implementing these strategies, the risk of bloat can be significantly reduced, ensuring the overall health and well-being of these wonderful pets. Treatment options. Treatment options for boxer dogs diagnosed with bloat can vary depending on the severity of the condition. It is important to consult with a veterinarian to determine the most appropriate course of action for your pet. Here are some common treatment approaches that may be recommended. Decompression techniques. In less severe cases of bloat, a veterinarian may attempt to relieve the pressure in the stomach by inserting a tube through the mouth or nose to release excess gas. This can provide temporary relief and buy time for further treatment. Surgery. In more severe cases or when decompression techniques are not effective, surgery may be necessary. The veterinarian will perform a procedure called a gastropexy, which involves attaching the stomach to the abdominal wall to prevent it from twisting again. Surgery may also involve removing any damaged or necrotic tissue. Medication. Depending on the individual case, medication may be prescribed to help stabilize the dog's condition and manage any pain or discomfort. This may include medications to reduce inflammation, control nausea, or promote healing. It is important to note that the treatment options mentioned above are not exhaustive, and the specific approach will depend on the unique circumstances of each case. The veterinarian will take into account factors such as the dog's overall health, the severity of the bloat, and any underlying conditions that may be present. Regardless of the chosen treatment approach, it is crucial to closely monitor your dog's recovery and follow any post-operative care instructions provided by the veterinarian. This may include administering medications as prescribed, limiting physical activity, and feeding a special diet to aid in the healing process. Remember, prompt intervention and appropriate treatment are key to maximizing the chances of a successful outcome for your beloved boxer dog. Post-treatment care. Post-treatment care. After undergoing treatment for bloat, boxer dogs require special care to aid in their recovery and prevent any potential complications. The following post-treatment measures are crucial for ensuring the well-being of your pet. Dietary modifications. Your veterinarian may recommend specific dietary changes to support your boxer dog's recovery. This may involve switching to a highly digestible, low-fat diet that is easier on their digestive system. It is important to follow these dietary recommendations strictly to prevent any further strain on their stomach. Exercise restrictions. During the recovery period, it is essential to restrict your boxer dog's physical activity. Strenuous exercise or vigorous play can put additional stress on their healing stomach, potentially leading to complications. Your veterinarian will provide guidelines on the appropriate level of activity for your pet during this time. Regular checkups. To monitor your boxer dog's progress and ensure their recovery is on track, regular checkups with a veterinarian are necessary. These checkups allow the veterinarian to assess their overall health, monitor any potential complications, and make any necessary adjustments to their treatment plan. By following these post-treatment care guidelines, you can provide the best possible support for your boxer dog's recovery from bloat. It is important to remain vigilant and attentive to their needs during this time, as proper care can significantly contribute to their overall well-being. Long-term management. Long-term management. After a boxer dog has experienced bloat, it is important to implement a comprehensive long-term management plan to ensure their ongoing health and well-being. This may involve making adjustments to their diet, exercise routine, and closely monitoring for any potential recurrence of the condition. Dietary modifications. One of the key aspects of long-term management is adjusting the boxer dog's diet. It is crucial to work closely with a veterinarian to develop a nutrition plan that meets the specific needs of the dog. This may include switching to a specialized diet that is easier to digest and reduces the risk of bloat. Feeding smaller, more frequent meals can also help prevent the stomach from becoming overly distended. Additionally, it is important to avoid feeding the dog foods that are known to contribute to bloating, such as large amounts of grains or gas-producing ingredients. Exercise routine. Proper exercise is essential for a boxer dog's overall health, but it is important to be mindful of their exercise routine after experiencing bloat. Strenuous exercise immediately after meals should be avoided, as it can increase the risk of the stomach twisting. Instead, it is recommended to schedule exercise sessions before meals or wait at least an hour after a meal before engaging in any vigorous activity. Regular exercise is still important for maintaining the dog's muscle tone and mental stimulation, but it should be done in a controlled and moderate manner. Monitoring for recurrence. Even with proper management, there is always a risk of bloat recurring in boxer dogs. It is crucial to closely monitor the dog for any signs or symptoms that may indicate a potential recurrence. This includes observing for restlessness, excessive drooling, a distended abdomen, or any other abnormal behavior. Regular checkups with a veterinarian are important to assess the dog's overall health and to detect any early warning signs of bloat. If there are any concerns or suspicions, it is essential to seek immediate veterinary care to prevent a life-threatening situation. In conclusion, long-term management of a boxer dog after experiencing bloat involves making dietary modifications, adjusting the exercise routine, and closely monitoring for any potential recurrence of the condition. By implementing these measures, pet owners can help reduce the risk of bloat and ensure the ongoing health and well-being of their beloved boxer. When to seek veterinary help. Understand the importance of seeking immediate veterinary help when you suspect your boxer dog may have bloat. Time is of the essence in treating this life-threatening condition, and early intervention can greatly improve the chances of a successful outcome. Bloat, also known as Gastric Dilatation-Volvulus, GDV, is a serious and potentially life-threatening condition that can affect boxer dogs. It occurs when the stomach fills with gas and twists, leading to a variety of symptoms and complications. Recognizing the signs of bloat is crucial, but knowing when to seek veterinary help is equally important. If you suspect that your boxer dog may have bloat, it is essential to act quickly and seek immediate veterinary assistance. Time is of the essence in treating this condition, as the longer it goes untreated, the greater the risk of serious complications and even death. Early intervention can greatly improve the chances of a successful outcome for your pet. By seeking veterinary help promptly, you can ensure that your boxer dog receives the necessary medical attention and treatment to alleviate their symptoms and stabilize their condition. When you notice symptoms such as restlessness, excessive drooling, unproductive attempts to vomit, a distended abdomen, or signs of distress, do not hesitate to contact your veterinarian. They will be able to assess your dog's condition, perform necessary diagnostic tests, and provide appropriate treatment. Remember, bloat is a medical emergency, and time is of the essence. Acting quickly and seeking veterinary help can make a significant difference in your boxer dog's chances of recovery. Do not delay in reaching out to a professional to ensure the best possible outcome for your beloved pet.